Okay, today the class is on the diaphragm. So, what do you mean by the diaphragm? The diaphragm, it is a muscular aponeurotic partition between thorax and abdomen. Means it forms a partition between the two region. The above one region is called as the thorax, the below region is called as the abdomen. And if you see the shape of it, its upper surface is convex on the right and the left side and depressed in the middle. The right dome is slightly higher than the left due to the presence of the lever. See, the right dome will be slightly higher because on the right side in the abdominal region you see the lever. So the right dome is slightly higher than the left due to presence of the lever. The muscle takes origin from the peripheral part and is inserted into the central tendon. Then what you have to learn here is, see, if you look a muscle, so when you look a muscle you have to learn about origin, insertion, nerve supply and action of it. Same way the diaphragm is a muscle. So here what are the key point you have to learn is, first is the origin, next is the insertion, next the nerve supply, and the last one is the action of the diaphragm. So look here, if we look first is, we'll come into the part that is called as the origin. So we look from where the diaphragm muscle is taking its origin. Origin, it has got following parts. Okay, you can see it has got three part. The three part are sternal part, costal part, and lumbar part. So these are the three part from which one is called as sternal part, next is called as costal part, and the last one is called as the lumbar part. Okay, so look here. If you look into this, we have seen that it has got origin from three parts: sternal, costal, and the lumbar part. Sternal means it is taking origin from sternum. Costal means from the costal cartilage and lip. Lumbar means it is taking origin from the vertebra. So look, first one, sternal origin. So from where it is taking origin is by two fleshy slip from the posterior accept of the Zifford process. Zifford process is part of the sternum. From the posterior accept of the Zifford process, it is taking origin. Which part? Sternal part. So remember, sternal part is taking origin from posterior accept of Zifford process. Okay, next, coastal origin. So, from what do you mean by coastal origin? So, it is taking origin from the ribs. So, which are the ribs? It is taking origin from inner surface of lower six ribs and the adjoining costal cartilage. So, from the inner surface of the lower six rib and from the adjoining costal cartilage, the diaphragm is taking origin. Okay, next you're looking, that is called as the lumbar origin. So, lumbar origin, if you look, it is the strongest attachment of the diaphragm on the posterior side. The lumbar origin is from lumbar vertebra and lumbocostal ligament. So, lumbar origin is from which one? I told you already. So, lumbar origin means it is taking origin from the vertebra, they are called as a lumbar vertebra, and from the ligament related, that is called as lumbocostal ligament. Okay, so if I told you about lumbar origin. So what will happen? See, from the lumbar vertebra. So right lumbar and the left lumbar vertebra. Okay, you have known that if I tell you the right crest is longer, means the diaphragm, the right crest is longer and arises from the upper three lumbar vertebra and the intervertebral disc. The left crest will be from upper to lumbar vertebra. The two crura are connected by tendinous arc in front of aorta called a medial arculigament. Just know that lumbar vertebra, right, is taking origin from upper three lumbar vertebra, whereas the left is taking origin from upper to lumbar vertebra. Okay, these are the two things you learn. Okay, so then the next coming is the lumbocostal ligament. There are two lumbocostal ligament. Okay, then next we are coming medial lumbocostal ligament and lateral lumbocostal ligament. So these are the contribution for the origin of the diaphragm. So what you have learned from the origin of the diaphragm? Okay, the diaphragm takes origin from three parts. First one is called as sternal part, next is called as the costal part, last one is called as the lumbar part. Sternal part from Gifford process, costal part from lower six ribs and costal cartilage, lumbar part from right will be from upper three lumbar vertebra, left will be from upper to lumbar vertebra. These are the origin of the diaphragm. This Okay, next. If you look in the next, you can see insertion where the diaphragm is getting inserted. Okay, all the fibers are inserted into the central tendon, which is situated in the median depressed part close to the sternum. It is trilobar in shape. You can see in the figure here. See, this is the these are all. See, you can see these are all the contribution of the origin. Okay, see here. See, it is taking origin from the vertebra. I told you about from the upper three lumbar vertebra. On the right, you can see. On the left, from the upper two lumbar vertebra, and from the ribs, it is taking. See, all of these are getting inserted into a part here that is called as the central tendon of diaphragm. So insertion, it is inserted to the central tendon of diaphragm. Okay, next we'll look what is the function of the diaphragm. So if you look into the function of the diaphragm, the main function, it is a part of the respiratory system. So function of inspiration, weight lifting muscle, thoraco-abdominal pump. Okay, these are the function of the diaphragm. So you should know it is the muscles of inspiration. Okay, after this, we see into the diaphragm. There are openings in the diaphragm. Okay, so the openings of the diaphragm are classified into group. One is called as the major opening. One more we classified into minor opening, major opening, and minor. Okay, in the diaphragm there are openings. The openings are classified into two groups. One is called as a major opening and one more is called as a minor opening. So major opening are, you have to know what are the major opening. They are this vertebral level, okay. So it is easy. T8, T10 and T12. Okay, T8, T10 and T12 are the major opening. These are the vertebral level. T8 level, T10 level and T12 level. Okay, these are the opening. So first you see T8, it is for the opening called as vena cava opening. So T10 we call it as esophageal hiatus or opening. Then next come aortic hiatus. So first one, vena cava opening at T8. What opens there is the vena cava. You see the inferior vena cava and some branches of the right phrenic nerve. It is a nerve, okay. Right phrenic nerve is a nerve which will supply the diaphragm. So it is called a right phrenic nerve. Next come esophageal hiatus. At what vertebral level? T10. You can remember, okay. Skip T8, T10, T12. Okay. Esophageal hiatus means esophagus. Then comes a nerve. They are the vagus nerve, large nerve, okay, vagus nerve, and some small esophageal arteries. Then aortic hiatus T12. Aortic hiatus means that word will tell you. It is for aorta. The aorta, the azygous vein and the thoracic duct. All these are the openings for the passage of the vessels to pass through it. So remember, esophageal, in vena cava opening, esophageal opening and the aortic hiatus. Okay, so see here, you can make out, see what, see this is the diaphragm you are looking. Okay, so these are the vertebrae, you can make out the vertebra. So vertebrae you can see T8, T10 and T12. So the first see, T8 is for the vena cava opening, T10 is for the esophageal opening and T12 is for the aorta. So by like that you can tell vena cava opening at T8, T10 for esophageal, T12 is for the aorta. These are the major openings of the diaphragm you are looking. Okay, we have looked about the major opening of the diaphragm. Next we are looking about minor openings of the diaphragm. So what are the minor opening you see? One is called Larynx space. It is a gap between Gifford process and the coastal origin of the diaphragm. We know where the diaphragm is taking origin. That is from Gifford. If you see a gap between them. So it will transmit a artery. This is the artery that is called as the superior epigastric artery. Next is a from behind lateral arcuate ligament, that is for subcostal vessels and the nerve. It will be subcostal vessels. Subcostal means 12th rib. There you see subcostal vessels and nerve. Behind medial arcuate ligament for a chain, that is called sympathetic chain. Then next comes right crest is pierced by, right crest means where you have seen the origin of the diaphragm, right? Right crest is pierced by great and lesser splanchnic nerves. These are the nerves, okay, greater and the lesser splanchnic nerve. Okay. So minor opening in diaphragm is for lateral space for superior epigastric, behind lateral arcuate ligament subcostal vessels and behind medial arcuate ligament sympathetic chain. Right crest is pierced by greater and lesser splanchnic nerves. So these are the minor opening of diaphragm. Okay, so practice this diagram. You have to learn and practice the time. So if I tell you how to draw, so see, this is a, see you see, this is a, you can make out. So this is a diaphragm, okay. See, the right crest will be higher and the left crest will be little down. And these are for medial and lateral arcuate ligament. You can see here, medial and lateral arcuate ligament. After that, you have to see for the openings. You can see in the center here, the first eight here, that is for vena cava opening. Vena cava opening is with inferior vena cava and right phrenic nerve. Okay, next you are seeing esophageal opening for left gastric artery and the vagus nerve. And next comes here aortic opening for the aorta, azygous vein and the thoracic duct. You can clearly see that. Okay, next is the small opening which you have spoken about. That is for the crest. You can see subcostal vessels and now see here medial arcuate ligament. That is for the greater and the here. You can see this. This is for sympathetic chain and the greater and the lesser splanchnic nerve. So you have to practice this diagram and you can remember what are the structure passing through. So remember what you have discussed in the diaphragm is the first is the origin, from where the diaphragm is taking origin, that is from sternum, then costal cartilage and then from the lumbar vertebra and insertion to the central tendon of the diaphragm. Next we have seen about the major opening. You can clearly see here. So for inferior vena cava, esophagus and the aorta. Then we have looked about inferior vena cava with right phrenic. Okay. Then esophagus with the right vagus nerve. Then with aorta with aorta, azygous and thoracic duct. Then here comes the splanchnic nerve and the subcostal vessels and nerve. So we have looked in detail all these things. So learn about with the diagram. Okay. Next coming to the nerve supply. Motor, it is a muscle, so it is motor. Okay, the motor nerve supply is from the nerve, it is called as a phrenic nerve. The motor nerve supply is from the phrenic nerve. Okay, so just go through it and learn what all we have discussed through it. Okay, thank you.